Hi, my name is Angela Matt. I'm a student nurse here, and I'm going to do a head-to-toe assessment on your newborn. So I've already washed my hands. And here is little Johnny Dog. And I've introduced myself to the mother, and I have checked my identifiers, the bracelet on the hand, and verified with the mother. And we would start out by just doing an overall assessment, look and see the temperature of the skin and make sure that the baby is bundled, and I would educate the mother on keeping the hat and the blanket on the baby. So first, we would just look at the overall appearance. Baby is happy, interacting. Skin is warm and dry and pink. And I would do the vital signs. I would save the most invasive for last. But I went ahead and did the temperature under the armpit, and the temperature was 98.4, which is in a good range. Regular temperature is 97.9 to 99.3. And I checked the respirations. The respirations were at 44. We would like it to be 30 to 60. And the apical heart rate, which we listened to for a full minute, was 142, and that's between 120 and 160. That's normal. So we would start at the top and work our way down. So as we're looking at the top of the head, we have our fontanelles. We have the anterior and the posterior. So the posterior will close within 3 months, and the anterior will close within 18 months. So we're going to want to make sure that those are smooth and flat, not depressed, and not bulging. We also would measure the circumference in centimeters. The length and the weight will also be checked. And as we work our way down to look at the face, we want to make sure that the whites in the eyes are white, not yellow. We're also looking for where the eyeballs fall. We want to make sure that it's lined up with the top of the ear. We're looking to see if the nose is midline. We want to make sure that the baby is looking at us, and we're going to look in the mouth. We're checking for cleft palate or anything like that. We would also move our way down. We're going to look and see where the nipples are placed, make sure there's only 2. We're going to listen to the bowel sounds, make sure that they're normal, active in all 4 quadrants. We're also going to listen to the lungs. We're listening to make sure that they're nice and clear, and that we have nice, even, symmetrical breathing. We're looking for the shape of the chest. We don't want a barrel chest. We're also going to look at the digits, make sure there's 5 on each. We're going to look at skin turgor. We're going to check behind the hand, on the arm, and in the belly to make sure that the baby is well hydrated. We're going to look in the groin area. We've already checked for patency at birth, but we're also looking to make sure everything is normal. And if it's circumcised, we're going to make sure that the circumcision is nice and kept clean and dry. We're looking at the umbilical cord. We're going to make sure that it's also not having any discharge or irritation there. And we're going to look at the back side. We're looking at the spinal cord, making sure there aren't any dimples or any signs that that is not closed correctly. We're also going to check the baby's reflexes. We can do the sit to stand, where they lay and then they kind of pull themselves up. We can do the step reflex, where we're going to see if the baby can lift as it's walking, or when it's standing, it will naturally want to lift and walk and step. And we're also going to check, you can put your finger here and the baby should grasp. We also want to push down on the foot, and the baby should be able to fan out the toes when you put the pressure there. And then also the suck reflex. You're going to put your finger right here, and the baby should turn towards whatever is putting pressure on them. So that about wraps up our head to toe assessment on our newborn.